hesitancy. So just to make a start then, the VCOD2 has been debated in Parliament prior to Christmas. We are expecting that either today or tomorrow that will go through its final legislative sign-off, but we haven't had that confirmed. But that's in order to allow a 12-week grace period prior to the 1st of April, which is when we believe this will come into effect. Full guidance hasn't been produced. There is sort of an outline information available, but we don't have full details of the actual guidance available for providers and exactly who isn't and isn't in scope. From what we understand, it's all CQC regulated services, and particularly those who are likely to have any form of face-to-face interaction with a person in terms of the patient, resident, or whatever terminology client is that you use. So that's it's patient in person receipt of services ultimately. So, but we are waiting for details of that. It may also apply in certain circumstances to other professionals entering that setting. So we're thinking potentially of extra care settings, supported living. We are not sure which route they will go down, whether they'll be akin to, for instance, a care home or a hospital, where all professionals visiting that home will have to show evidence that they are fully vaccinated, or whether it will be similar to those in the community services where it be deemed as their own home and they don't need to do that. So we are waiting for information of that. So working back in terms of a time frame from 12 weeks from today, obviously takes to the 1st of April for full implementation. To allow the 8-week gap between the vaccinations, so first and second vaccine, to allow the 8-week gap, we are assuming that all vaccinations, the first vaccination must have taken place by the 3rd of February, in order for them to have had their last vaccination prior to the 1st of April, the second vaccination. As it stands at the moment, and I'm sure will not change immediately, certain for people who are within scope of this, full vaccination status is for 2 vaccines. It doesn't include the booster, but there are indications that is likely to change in the next few weeks, and may include the booster. But I would imagine that, again, there'll be some form of grace period to allow for that to be implemented as well. If I can just ask you all to go on mute, if you're not currently on mute, it would be brilliant. Thank you. So we're working towards a very short time frame, literally the next 4 weeks, in which to get any staff who aren't fully vaccinated. Now, we are starting from what we can see in the capacity tracker with a higher baseline than where we did with care homes, which is really good news. And I'm sure Ben will be able to give us an update of actually where we are in those statistics. And hopefully you've all been able to have those supportive conversations with your staff, enable them to get the vaccinations. And the current sort of Omicron situation may have encouraged more people to do so as well, but we do understand there's a lot of people that are quite concerned about how actually they get the vaccination, whether they need that, etc. So what they will all need to do once they have had that vaccination is obviously provide proof to you that have had the vaccination, and that will be through a COVID pass, which is an NHS app that can be downloaded. And all staff will be able to do that, as they have done for care homes, and you will then be able to register that and then store that information for CQC to evidence the fact that all your staff are fully vaccinated. That's come through. And likewise for care homes, I mean, we are expecting again that some stage they will make it so that the full vaccination status, because that's actually what's in the legislation, they talk about being fully vaccinated, and the definition of being fully vaccinated currently is 2 doses. But that isn't likely to change to include the booster at some stage, but we don't know when. But again, there will need to be some form of grace period, because what we are seeing is that booster uptake is relatively low in the care sector for staff. It's great for residents and such like, and for service users, but actually for staff, it is relatively low. It may be because some of them aren't eligible at this stage because it's so close to having had their second vaccine. But yeah, it is something it is a concern, and obviously, and many are sort of exercising their right to wait until it does become mandatory. But certainly for being fully vaccinated with 2 doses, they will have to have had that done by the 3rd of February in order to continue to work after the 1st of April, unless obviously they do, catch COVID in that process, and it is slightly delaying it. Staff who've only had 1 vaccine will not be able to work unless potentially there is this they do have some form of exemption if you have been delayed in getting your vaccine because of a COVID infection. So you must be fully vaccinated in order to continue to work. It will be a condition of deployment. So in care homes, nobody is allowed to cross the threshold of a care home who isn't doubly vaccinated and who doesn't evidence on the visit that they are doubly vaccinated. So you will therefore, as a condition of the deployment and then continuing to work, will have to have had that second vaccine. The first vaccine, yes, is by the 3rd of February. In order to have that 8-week gap to allow you to be fully vaccinated, or having the 2 vaccines by the 1st of April. But we are still waiting on the confirmation from the Government Department of Health and Social Care of exactly of that time frame, but that is what we're working towards at this moment in time. There might be some slippage with that, but we're not sure. I think they are keen obviously to keep going on that as well. So obviously conversations will need to happen over the next 4 weeks with your staff around those that aren't vaccinated to say, okay, this is the deadline by which you need to have had your first vaccine. And obviously for those who've had the first but need to have the second, then it would be, you know, the 31st of March would be their deadline for having their second vaccine. And if at that stage they don't have that vaccination, then you will legally be able to dismiss them. But obviously what you must do is make sure that you're following the due process around that as well. So we've got some resources that we can help with that as well, as we go through things that ACAS have pulled together that we've used. Now, we did find in care homes, the vast majority of staff, very few left the sector. In all honesty, Ben, have you got the updates on the figures in the end? How many people left the sector because they weren't willing to be vaccinated?
We haven't got a definitive figure, but I can tell you it's less than 50.
Yeah, so out of about 4,500 who work in care homes approximately, there was 50 staff who left. So it was a really low percentage and lower than what we initially feared. And most in the end were supported. There was one care home that I believe had about 19 staff at one stage who were out, hadn't been vaccinated. And in the end, they were all supported to be vaccinated. You know, it was up to the last minute, but they all eventually were supported to be vaccinated through that. In terms of office staff requiring the vaccination, so obviously we know that in terms of in-scope as CQC regulated, anybody who provides CQC regulated services, if they are unlikely or won't be having any face-to-face contact with a person in receipt of services, then technically they don't need to be fully vaccinated. But we know in this sector that quite often if you're working in the office, there's still times that you might have to go out onto care and different things. You know, if you work in a hospital, even on reception, you're going to come encounter people. The chances of you not encountering a person face-to-face are very slim in many of this industry, but there will be some scenarios where people won't need to be vaccinated. And it should be said that anybody who can be redeployed, you should redeploy if you do have that function to being able to people to go purely work in the office. You would have to look at that redeployment into that role if there is that option available. We know in most instances that's not something that's going to be possible going forward. Just in terms of, just look at some of these other questions, if service users come into office at time, yeah, so service, like say, if service users come into the office and such, you know, and things like that, then yeah, there's so many reasons. It's very few people who wouldn't, generally speaking, we're talking about if you had a head office only, or something like that, where you would actually be in that scenario. And just another thing in the chat, obviously it was something about office staff in care homes. Yes, they do need to be vaccinated because the chances of a care home having a completely separate office to the residents within the care home are slim. So there is every chance you will come into contact with those residents. Therefore, essentially, everybody who crosses the threshold of a care home has to be vaccinated, including visiting professionals. Now, that is something, as I've said, we're waiting to find out whether that will apply to the likes of supported living and extra care settings. We are not sure yet until we see the guidance. Ben, I don't know if this stage you want to bring up the flow chart of what this was, a screen grab, wasn't it, from one of the webinars. So this isn't necessarily official, but it's just to give you some idea of who may or may not be in scope.
Yeah, of course. So as Louise mentioned, this was a screen grab by my colleague during the local authority stakeholder engagement. So I just want to double check. Can you see the flow chart?
yes, we can.
Perfect. Yeah, so the general principle of who's in scope, I know you can see it on the screen, but I'll just quickly go through it. So has a non-exempt individual been employed or engaged to provide a CQC regulated activity? If yes, has the individual been employed or engaged by a person for the provision of this activity? Again, if yes, it would this activity be direct and face-to-face? And again, yes, then that person would need to be vaccinated. Obviously, under any point of that, if you're saying no, then chances are the person won't be in scope. So go back to the first point. So if no, might the individual ever be required to provide CQC regulated activity even while it's not part of their day-to-day role? Again, that would include the conversations around office staff that were primarily in the office, but may potentially, if you were short-staffed, need to go out. So if they would never need to go and provide any CQC regulated activity, wouldn't ever expect to leave the office and go and support someone, then they wouldn't be in scope. But if they would, again, if you were short-staffed, or I suppose the thing is have they received care certificate training, for example, then the chances are that they would be under scope because they will have had that training for a reason. But it's just a very short and simple, sort of flow chart, and hopefully it'll be something that is finalised, or if not, we'll create a local version so it's very readily available for you to see, and this will be included in the document. And I suppose the other thing on here is what are regulated activities, or what that could be applied to. So personal care, nursing care, treatment of disease, disorder and injury, and also transport services as well are included in that. Thank you.
Louise.
Yes, Gavin.
Just coming back on that, I appreciate that is a screen grab, but that matches virtually word for word the national guidance that have been shared across the NHS. So there is a NHS document which has got that on there.
Right. So fingers crossed it won't look too dissimilar when we do get the guidance at some stage as well. And just to say around, people where you may have clients and service users within the community who aren't vaccinated and are choosing not to be vaccinated, yet your staff are forced. Yeah, I completely agree. It might be frustrating, but actually it is about that duty of care. It is about protecting that individual. And if they are willing or able to protect themselves, and actually this is something that you can do to protect them and to support them, and and make sure that they don't pass on or less likely to pass on any COVID infection to them, which if they're not vaccinated could be potentially very dangerous. So it is about that duty of care and how we can support. Now, again, another question around about whether PAs are to be included, and our understanding, Ben, is that they are, aren't they, I think? Is that right, Ben?
It's a little bit muddied, unfortunately.
Yeah.
From the stakeholder engagement, the answer was yes. But when I went back, because again, one of the big things is how we're going to monitor this, how are we going to ensure that people are being vaccinated, because there is no way of monitoring this really. The answer from the Department of Health and Social Care was that they're probably not going to be included. So I've got one answer saying yes and one answer saying no. So my position is we're waiting for the final guidance. It's on our radar, and I'll make sure to update people as soon as possible. So I've already notified the direct payment team that it's something that could be potentially included. And I know it's the questions come from Sam, so I'll make sure to keep you updated as well.
Right. Thanks, Ben. The other thing is just to say, if we find out again that in certain settings like extra care and supported living, it will be similar to that of a care home where you'll have to evidence that visiting professionals are vaccinated. There is an app that was developed by a care association called Verify Plus that care homes are using. And that enables you to store a record of who comes to the premises, who has been vaccinated. So once they've presented that evidence to you via their NHS COVID pass that they are vaccinated, you're able to store that securely without meeting all sort of GDPR regulations, to say that yes, this person, I've seen their vaccine pass, and I now know that I don't have to ask them on their next visit. It just recalls that information. It's all held in a cloud, it's all safe, and that is currently being looked at how that can be adapted if it's needed for other settings. So that the likes of extra care, supported living, and potentially even things like GP practice and things, if they're going to be in scope. So that is being looked at this moment in time, and we'll be ready, and we'll make sure that people are aware of that that does become that it is in scope, and we'll let you know. And yeah, we're using another commenting around Verify Plus. It is really simple and easy and making our life a lot easier, and we're adding more and more to that all the time to make it better and more functional as well. Yeah, just to say around the agency situation, and I don't know how many people, I suppose in certain settings you will use agency staff. So the agency staff is a bit of a loophole at this moment in time, because ultimately they're providing regulated services. However, the agencies themselves aren't regulated. So the Department of Health and Social Care government actually don't have a sight of how many agencies are out there, who those agencies are, how many staff they have on their books, etc. And what we have seen is certainly a move from care homes, people, and then even obviously within the NHS, who people who weren't willing to be vaccinated to potentially towards working in agencies. And a lot of those where they couldn't be deployed into care homes have more than likely been deployed into other settings that it was permissible to go across to without being vaccinated. So what you will also have to check is that any agency staff that you're using are also fully vaccinated. It is going to be a bit tricky to get around to full sight of this information, and for the Department of Health and Social Care to regulate it and check that. So it is something that will be on your onus to actually do that and to double check that they are vaccinated. But we know that their uptake was relatively low a few months ago compared to what sort of care homes, etc. I think it was about 40% of their staff were vaccinated at one stage, what they were indicating at the time when VCOD came into care homes. So it's just to be aware that if you do use agency staff, you must check that as well. So if you're a non-regulated service, we don't perform regulated activity. So if you're non-regulated and it's not regulated activity, then it actually won't be applicable. You'll be out of scope for that, according to the diagram as it stands at this moment in time. But we're still awaiting that full guidance. I mean, obviously, it is advisable for any setting that comes into contact with vulnerable adults or children that everybody is fully vaccinated to support and protect, part of that duty of care and to protect the people that you're supporting in that setting. So although it may not be mandated, it's certainly advisory going forward, but we'll get more information on that going forward as well. Are there any other questions from anybody? I think we've answered most of the questions that were in the chat. I know there's still a few more questions and answers at this moment in time. Anything from anyone? Please feel free to put in the chat or ask. In extra care visiting press, can someone who lives there without care team's knowledge be buzzed in? Well, this is, I think, the difficulty. So yes, so in extra care settings, obviously you have the actual the property owner, if you like, or people who are in charge of the actual the property themselves, and then you have the care company who are in there. And separately to that, we don't know because an individual with their own accommodation in there, with their own property, could arrange for a plumber, for instance, to come and sort something out. Actually, will they then need to be checked at the door by whom, etc. So this is where we don't know whether this is going to come into scope or isn't. What I can say is that in certain extra care settings where they are adjoined to a care home, they've had to take this approach for all, because they are adjoined to a care home and there's no sort of differentiation between the two physical as such. So it's then they've had to go with that they're operating under the regulations as if they are a care home. So it will be depending on the setting, and obviously sheltered accommodation will be slightly different to a true extra care setting and such. So we'll have to work through the different nuances of this once we get the guidance around that. But yes, it could be a challenge when we do get to that stage, because we are waiting to find out on that.